Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been pretty active with my daily routines and using the weights, though I've noticed mild discomfort during specific exercises. It's not severe, just a bit bothersome. I've continued taking my medications regularly, including the new one for the bladder issues, oxybutynin, which seems to help a bit.
It's good to hear you're staying active and managing the discomfort. How have your urination problems been since starting oxybutynin? Any noticeable improvements or side effects?
Yes, there's been some improvement. The bladder urgency isn't as bad as it was, but I still find myself going more often than I'd like. No serious side effects, though, which I'm thankful for. I've been very cautious with new medications since I chose not to go ahead with finasteride due to potential side effects.
I understand your concerns, especially about managing potential side effects. It's important that we find a balance that works for you. How about your cholesterol and blood pressure? Any issues there since your last visit?
Not that I've noticed. I've been diligent with my diet and medications. My wife and I share meals, which are generally light, as we both try to watch our health. I guess that's partly why I've lost some weight.
Your proactive approach is commendable. Let's ensure we're keeping everything well monitored, especially your cholesterol and blood pressure, which are crucial given your family history. Have there been any changes in your digestive health or discomfort since stopping aspirin and starting omeprazole?
The acid reflux has definitely improved since I stopped the aspirin. The omeprazole seems to be working well. I take it regularly after meals, and it keeps the discomfort at bay.
That's excellent to hear. Managing acid reflux effectively can significantly improve your quality of life. Now, about your dental health, you mentioned ongoing issues.
Yes, dental health is still a bit of a concern. I've had some extractions, and my dentist mentioned there might be more to come. It's a bit of a process, but I'm getting through it.
Keeping up with dental health is important, especially as it can affect other areas of your health. We'll keep an eye on that. Now, tell me a bit more about any other symptoms or health concerns that might have come up recently.
Well, there's nothing new, really. I've been feeling generally well, aside from the usual concerns. I'm keeping up with my exercises and medications as prescribed.
That's good to maintain stability with your health. Let's go over the lab results and plan from here. Your weight is currently 185 pounds, which is down from 190 pounds 6 months ago. Your blood pressure today is 110/70 mm/Hg, which is a bit lower than usual but within a safe range. Your heart rate is stable at 78 BPM.
That sounds about right. I'm glad the numbers look good.
Your lab results are also reassuring. Your kidney function is normal with a serum creatinine of 1.1 milligrams per liters and blood urea nitrogen at 18 milligrams per liters. Your cholesterol management is excellent with an LDL under 100 and triglycerides at 109. Your liver enzymes, AST and ALT, are within normal limits and your serum electrolytes are stable.
That's great to hear, doctor. It feels good to know things are under control.
Absolutely. You're doing well managing your health. As for the next steps, I would like you to continue with your current medications and lifestyle adjustments. We'll schedule another round of labs in 6 months to monitor your progress. We should also coordinate your upcoming colonoscopy as you're due for this screening. I'll have my team set that up for you. Lastly, let's plan for an update on your eye exam since it's been a year. Monitoring your vision is important, especially with the changes in health and medication.
Sounds like a plan, doctor. I appreciate your help and the clear rundown of everything.
You're welcome. It's my job to ensure you stay informed and comfortable with your health management. If anything changes or you have concerns before our next appointment, please don't hesitate to contact us.
Will do. Thanks again, doctor.
Take care and see you in 6 months, if not sooner. Keep up the great work with your health.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. I see you're here today to discuss a few ongoing issues, including your sleep and blood sugar levels. Can you tell me more about what's been happening?
Good morning, doctor. Yes, it's been quite challenging recently. I've been struggling with insomnia. I hardly get 4 hours of sleep a night. I've noticed that lying on one side causes me pain, and I have to switch positions often. Even with that, I end up taking naps during the day, which I know isn't ideal.
That sounds quite disruptive. And how about your blood sugar levels?
They've been all over the place. I've been monitoring at home, and sometimes the readings are unusually high or low. I'm starting to question whether my meter is accurate or if something's off with my medication.
I see. We'll certainly look into that. Have you made any changes to your diet or medication recently that might affect your readings?
Not really, doctor. I've been sticking to the diet plan, but these fluctuations are puzzling me.
Understood. You also mentioned pain from your previous gallbladder surgery site and issues with your bowel movements.
Yes, the area where I had my gallbladder removed sometimes feels painful, especially after I eat certain foods. My bowel movements haven't been regular either, which is concerning.
All right, we'll need to keep an eye on that. Let's also talk about your thyroid condition. How has that been lately?
The thyroid's been stable, as far as I know. The last ultrasound didn't show any significant changes in the nodules or enlargement, though my thyroid levels were slightly high recently.
Okay, that's good to know. And your sinus issues, are they still being managed well with the nasal spray and loratadine?
Yes, those medications help a lot. I've noticed less congestion, although I'm aware there's still a polyp in my sinuses.
Good. It sounds like the treatment is effective for now. I understand these issues are quite complex when looked at together. Let's go over some of your recent test results to get a better picture. Your blood pressure today is 185 mmHg, which is slightly high, and your heart rate is normal at 78 beats per minute. Respiratory rate and body temperature are also within normal limits.
I was wondering about those. Are they okay?
Yes, these vitals are generally okay, but we'll keep monitoring your blood pressure. Now, looking at your blood sugars, your fasting level today was high at 186 milligrams per deciliter, though it improved to 111 milligrams per deciliter postprandially and 116 milligram in the evening. This inconsistency why you're feeling off.
That could explain a lot. What about my cholesterol and liver functions?
Your total cholesterol is at 199 milligrams, with your LDL at 120 milligram and HDL at 45 milligram. Triglycerides are 150 milligrams per milliliter, which are slightly elevated, but not alarmingly so. Your liver function tests are normal with AST at 28 UL and ALT at 30 UL.
And my thyroid levels?
Your thyroid-stimulating hormone, TSH, is at 3.5 microGui/ml, and free T4 is 1.7 g/ml, which are within normal ranges, though we need to monitor them closely given your symptoms and previous history.
What would you suggest we do next, doctor?
Given everything we've discussed, we need to enhance your sleep hygiene. Consider limiting caffeine to mornings and avoiding naps to help regulate your sleep pattern. I recommend using a new glucose meter to ensure accurate readings. It's crucial to monitor your levels more consistently. We'll continue monitoring with regular blood tests and another ultrasound in a few months. I might adjust your Synthroid dosage based on upcoming tests. Given the polyp and your symptoms, a referral to an ENT specialist might be necessary if there's no improvement. We'll reassess everything in our next appointment, and please reach out if anything worsens or if you have new concerns.
Thank you, doctor. I appreciate the detailed plan and look forward to feeling better soon.
You're welcome. We're here to support you through this. See you at the next appointment, or sooner if needed.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hello. I'm glad we could meet today to discuss the care plan for your baby. Since your little one arrived early, there are specific care strategies we need to implement to support their development.
Yes, thank you. We're a bit overwhelmed. What kind of special care will our baby need?
Understandably so. First, your baby will be in an incubator to help maintain body temperature and protect from germs. This is crucial as their body isn't fully developed to regulate temperature on its own yet.
How long will they need to stay in the incubator?
It depends on how well they progress, but it's typically until they can maintain their temperature and have started to gain weight consistently. We also monitor their heart rate, breathing, and other vital signs around the clock.
What about feeding? I've heard that can be challenging.
Yes, feeding is very important. Since premature babies often can't suck or swallow effectively at first, we may start with IV nutrition and then move to tube feeding as they grow stronger. We'll work closely with you on breast milk options and the transition to bottle feeding when they're ready.
Is there anything else we can do to help?
Definitely. Skin-to-skin contact, also known as kangaroo care, is very beneficial. It helps with bonding, stabilizes their heart rate, and improves oxygen saturation. Plus, it's a wonderful way for you both to connect with the baby.
Now look at question 26.
Welcome, everyone. Today, we're going to discuss the importance of palliative care and how we approach these conversations with patients and families. Palliative care is about providing comfort and support to patients at any stage of illness. It's crucial that we address physical symptoms such as pain and nausea, but also psychological, social, and spiritual issues. Our goal is to improve quality of life for both the patient and their family. Let's talk about how to initiate these conversations. It's about being honest, empathetic, and clear. Ensure that the patient and family understand their options and that we are here to support them every step of the way. Lastly, remember that these discussions should be a continuous process, not a one-time conversation. Are there any questions so far?
Now look at question 27.
Good morning. Today we need to discuss starting dialysis due to your kidney function levels. Have you heard about dialysis before?
Yes, but not much. I know it helps with kidney failure, right?
Exactly. Dialysis performs the function of your kidneys when they can no longer do it themselves. There are two types, hemodialysis and peritoneal dialysis. We'll find the best option for you.
Does it hurt? How often do I need to do it?
It shouldn't hurt. Hemodialysis typically requires visits to a clinic 3 times a week. Peritoneal dialysis can be done at home daily. We'll train you thoroughly on the process.
What about side effects?
There can be some, like fatigue or low blood pressure, which we'll manage together. It's important to maintain your appointments and follow the diet we'll set up for you.
Now look at question 28.
Today we're going to review the process of case management in our hospital. This is vital for ensuring that our patients receive coordinated and efficient care. Case management involves assessing, planning, facilitating, and advocating for options and services to meet an individual's health needs. It requires communication across various departments. During our reviews, we look at patient progress, treatment plans, and discharge planning. It's important for all involved departments to be updated and agree on the care plan. Any changes in patient status or treatment plans need to be communicated promptly to all stakeholders. This ensures that the patient's care pathway is as smooth as possible. Any questions on this process?
Now look at question 29.
Hi there. Today I'm going to show you how to care for the wound properly. You'll need clean hands and a sterile environment. Let's wash our hands together.
Got it. What next?
Next, we'll gently remove the old dressing. Watch closely as I do it. We need to be careful not to reopen the wound.
Okay, I see. It doesn't look too complicated.
Good observation. Now we'll clean the wound with saline solution. It's important to pat it dry gently. Then apply a new sterile dressing. Make sure it's snug but not too tight.
Does it need to be changed daily?
Yes, and anytime it gets wet or dirty. Do you feel comfortable trying it on your own tomorrow?
Now look at question 30.
Good afternoon, everyone. Today's focus is on our pediatric immunization schedule, an essential part of preventative health care for children. We follow the CDC guidelines, which outline when and which vaccines should be administered. It starts from birth and continues into adolescence. It's crucial to adhere to these schedules to protect children from various preventable diseases. This also includes booster shots at certain ages to maintain immunity. We encourage parents to keep a record of all vaccinations. It's essential for school registrations and in case of any outbreaks. Are there any concerns or questions about specific vaccines?
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Welcome everyone to today's healthcare seminar. I'm delighted to be here to discuss a complex and crucial topic in the field of addiction medicine, specifically focusing on alcohol-related liver diseases and their treatment outcomes, including liver transplantation. Our discussion will be grounded in recent scholarly articles and clinical guidelines to provide an in-depth understanding of this significant health issue. Firstly, let's consider a case study that exemplifies the real-world challenges and considerations in treating alcohol-related liver diseases. We have a patient, let's call him John, a 45-year-old male with a long history of alcohol dependency, who presented with decompensated liver disease. His medical history is significant for multiple hospitalizations due to alcohol withdrawal and one episode of esophageal variceal bleeding. John's case is a poignant example of the severity that alcohol abuse can impose on physical health, particularly on the liver. According to research from Harvard Medical School, alcohol-related liver disease, ARLD, is a spectrum that ranges from simple steatosis to alcoholic hepatitis and progresses to cirrhosis. For patients like John, who develop cirrhosis, the risk of liver failure becomes a critical issue, necessitating potential liver transplantation. The ethical considerations in liver transplantation for patients with a history of alcohol abuse are complex and multifaceted. According to a review published in the Journal of Hepatology, candidates like John who have alcohol-induced liver disease are often subject to a mandatory abstinence period, commonly 6 months, to qualify for a transplant list. This abstinence criterion, however, is debated among professionals due to its somewhat arbitrary nature and the urgent medical need of many patients. In John's situation, the multidisciplinary team faced the challenge of assessing his eligibility for a transplant. This involves not only evaluating the medical necessity and the patient's liver disease status, but also considering the psychological and social factors that might impact post-transplant compliance and sobriety. Harvard researchers emphasize the importance of a robust psychosocial evaluation to mitigate the risk of alcohol relapse, which can jeopardize the success of the transplant. Management of John's condition prior to any transplant decision also involves addressing his acute symptoms and preventing further complications. A study from the New England Journal of Medicine highlights the use of a symptom-triggered therapy approach for managing alcohol withdrawal syndrome, which has been shown to be effective in reducing the severity of withdrawal and improving patient outcomes. Furthermore, addressing John's alcohol dependency itself is crucial. Integrated treatment programs that combine liver disease management with addiction services can provide a holistic approach to care. Such programs, as discussed in a Harvard review, advocate for a combination of medication-assisted treatment, psychological support, and social care interventions tailored to individual patient needs. Ultimately, the decision regarding liver transplantation in cases like John's involves careful consideration of medical, ethical, and social factors. This complex decision-making process is supported by evidence-based guidelines and tailored to individual patient profiles to maximize the potential for successful outcomes and improve overall quality of life. Managing alcohol-related liver disease, particularly at the advanced stage requiring consideration for transplantation, involves a multidimensional approach. It necessitates not only medical intervention, but also ethical judgment and comprehensive support systems to address the underlying alcohol dependency. The case of John is a clear illustration of how healthcare providers must operate at the intersection of various medical and social disciplines to deliver effective care.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to today's educational seminar on the management of acute coronary syndrome, ACS, with a focus on recent updates in clinical guidelines and real-world application. I'm Dr. Andrew, and I'm specializing in interventional cardiology at the Royal Infirmary of Edinburgh. Today we'll delve into the complexities of ACS, integrating the latest research with a case study to better understand practical implications. Let's begin with an overview of the key changes in the management guidelines for ACS. Recent updates in both the NICE and ESC guidelines have shifted the approach, especially regarding pre-treatment with P2Y12 inhibitors. Traditionally, we preloaded patients with P2Y12 inhibitors such as ticagrelor, prasugrel, and clopidogrel alongside aspirin before coronary anatomy was fully understood. However, updated guidelines now recommend holding off on P2Y12 inhibitors until after the coronary anatomy is delineated via angiography. This change stems from studies showing no significant benefits in mortality or stent thrombosis with pretreatment, but a noticeable increase in bleeding risks. To illustrate, let's consider a case study involving a 68-year-old male patient named John, who presented to the emergency department with chest pain. His initial ECG showed no definitive signs of ST elevation myocardial infarction, but there were some nonspecific ST changes. His troponin levels were elevated, and based on these findings, an NST was suspected. John's management began with the administration of aspirin and a short-acting anticoagulant, heparin, as per the revised guidelines. Given his stable condition, we postponed the administration of a P2Y12 inhibitor until after the coronary angiography. The angiography later revealed significant single-vessel disease, amenable to stenting, at which point we initiated ticagrelor. Discussing risk stratification, the revised guidelines emphasize using tools like the GRACE score to better categorize patients' risks and tailor their treatment. John's GRACE score suggested an intermediate risk, which supported our decision for an early invasive strategy, but also cautioned us regarding potential bleeding risks due to his age and comorbidities. Another significant update in the guidelines concerns the management of dual antiplatelet therapy, DAPT. The decision regarding the duration and intensity of DAPT now heavily considers the individual bleeding risks versus the thrombotic risks. For John, given his risk profile and the successful placement of a drug-eluting stent, we recommended 12 months of DAPT, balancing between mitigating thrombotic risks and minimizing bleeding risks. The complexity of managing ACS does not end with stenting or medication alone. A holistic approach, including lifestyle modifications and management of comorbid conditions, is critical. For John, this involved optimizing his diabetes management, introducing statins for lipid control, and encouraging lifestyle changes such as diet modification and regular physical activity. Moreover, the updates also touch upon the management of patients with concurrent conditions like atrial fibrillation, where the balancing act between anticoagulation and antiplatelet therapy becomes even more precarious. This aspect of care requires integrating the CHU-DS2 VASC score with clinical judgment to tailor antithrombotic therapy effectively. The recent updates to the ACS management guidelines offer a more refined approach to treating this complex condition, focusing on personalized care and risk-based management. As we saw with John, applying these guidelines in real-world settings requires a careful, nuanced approach to each patient's unique clinical scenario. Thank you for your attention, and I look forward to discussing these points further during our Q&A session.